Hello, today I will discuss about what are some OCD symptoms. Uh, I am counseling psychologist and I am working on OCD, that means Obsessive-Compulsive Disorder, for last 12 years. Today, this is an important video for those people who are going through OCD, or that means Obsessive Compulsive Disorder, and that cannot be explained, that cannot be identified for themselves. This is a neurological disorder that create various problem in mind, body, and our behavior. Obsessive compulsive disorder can be defined as this is an recurrent, persistent, intrusive thought, image, or impulses. That means when a person suffer from OCD, they can recurrently work anything that can be stress for him, and also he cannot identify why this is happening in my mind and why I am doing the same thing again and again. When a person going through this type of behavioral symptom, then they create excessive behavioral symptom, if I identify or if I discuss about the contamination fear. That means the people who are suffering from OCD and who have contamination OCD, he can be worried about germ like dirt or illness. If I provide example, like he can think, did I touch something dirty? This is the a paranoia thinking for him. Also harm OCD, the person who going through harm OCD, he or she think, will I harm other, or may I be harmful for other? They think again and again, or they may think, what if I accident, if I do accident and hurt someone else. Also there are perfectionism. That means the people who are suffering from OCD, he want to be perfect in every sphere in his life. uh, Next, unwanted thought. The person who are suffering from OCD, he think that few thought, that is not him, that is not her. Someone recurrently tells something, that's why he is doing the same thing again and again. This symptom is severe for our mental health condition, because when a person does not identify and take treatment, then once it can create psychosis. Psychosis is a severe mental health condition that can be harmful for the people and harmful for the family who are suffering from OCD, and persistently this affects his or her physical, mental, and social life. Next, the common compulsion behavior. This is also an important. The first one, the cleaning and washing. The people can wash or clean table, desk, his or her chair, his or her board excessively, and this can be stress, and this stress can be arise and increase day by day. Next, checking. Repeatedly checking locks, appliances, or personal belongings. Then repetitive actions. That means the person can performing something specifically again and again, and turning turning a light on and off a set number of times. Next, the mental rituals. I think this is an important aspect, because when these rituals go through under treatment, then it can cause the psychosis. Like he or she can silently counting, praying, repeatedly phrasing something, neutralizing anxiety. When a person suffer this symptom, they can go through severe conditions if his or her OCD cannot be treated. Then the next one is physical and emotional symptom. The physical symptoms can be fatigue. He can skin irritation. He can excessively do washing, and the emotional symptom like anxiety, guilt, frustration, and the symptom being unable to control his obsession and compulsion. The severity of impact can be defined as like the OCD can be severe in three types, like mild, moderate, and profound or severe. When a person suffers from OCD or preliminary stage, it can be mild to moderate, and if they don't go through treatment, then it can be severe and profound. When a person go severe, then he or she need psychiatric treatment, because this is a neurological disorder when neuron in our brain cannot balance like serotonin, dopamine, then OCD can be happened, and there are many symptoms that can be arises in person's life. Also, there are other symptoms like the religious OCD. The person can think more and more about religious issues. They can suffer from sexual issues, like they can image something. They can show their paranoia, thinking like with his family member, like mom, sisters, and other different sex. At the same time, if happen for the female, then they can show their paranoia thinking who are belonging their surrounding, like father, brother, neighbor, colleague. So this is an important and most crucial on disorder. There are treatment. This suggestion, if any person who are suffering from OCD, I request to go for treatment. There are two type of treatment, like psychiatric medicine, who is provided the psychiatrist, and CBT based cognitive behavior therapy, that is important for dealing with OCD, that can be provided by a professional counselor or clinical psychologist. So take treatment and be happy in our life. Thank you. Subscribe my channel if you are new. Thank you.